Hi, I'm Henry Shelford. I'm chairperson of SarcoidosisUK, and we said we'd come back today and do a full Q&A to celebrate that we've got a new senior executive in Alan, and also talk about Jack and that he is moving on, but he is not moving on completely. So we're excited that he's going to stay with SarcoidosisUK as a trustee. So we're transitioning over the next couple of months. So he's still here, so he can still email. He's still helping, and it's great to have that period. And then it's going to be over to Alan on his own. But we're thrilled. You know, our little charity is growing, and we're really excited. Obviously, we introduced Alan in our last video, but we didn't really talk about Jack. So I think one of the main questions that people have wanted to ask is obviously to celebrate what Jack's done and everything. And the charity honestly wouldn't be where it would be without him, and we are truly grateful for that, and thrilled that you're staying around. But so where are you going? I think a lot of people wanted to know that. So what's tempted you away? Our important goals. Funding research towards a cure. There you go.
I still very much support research towards a cure for sarcoidosis. No, it's taken 4 and a bit years for me to be tempted away from Sarcoidosis UK, because I've had an amazing time here, and this isn't a kind of acceptance speech, but it's been it's been a fantastic 4 and a bit years. But I've learned so much working with Henry, working with so many amazing volunteers, now working a bit with Alan and our amazing trustees and so many people. But I have always had a real desire to want to work outside, out in nature, getting dirty, and unfortunately it's one of the few things that Sarcoidosis UK can't really provide particularly well. And so I'm moving on in a couple of months. Be starting a job with a forest school charity, possibly a bit with a charity and a bit freelance as well.
Can you explain what a forest school is? Because many people might be thinking you're planting trees, and that's not what you're doing, is it?
I have planted some trees, but that is not. Forest school is a type of alternative education, which is mostly for nursery and primary school age children, and it usually works alongside mainstream schooling, and it's about getting children, particularly those with behavioural difficulties, out into woodlands and to increase their confidence and their independence, and learn about nature. So I'm doing my training for that at the moment. It's going really well. I'm really excited, and it's amazing that I've got the opportunity to stay on as I am at the moment, 2 days a week, work with Alan, and make sure that all of the amazing work that I've been involved with can be handed over to him properly.
We're very lucky for such a seamless transition, and obviously that you're staying. When Jack first came to me and said, "Look, this is what he wanted to do," and he had previously extended staying with us. This is something he's wanted to do for a while, and he's known how much he's been achieving, so he's wanted to stay and be involved in that. And so he's stayed much longer than I think he ever planned to, and it's been wonderful. So that turns us to the new Jack, which we prefer to be called Alan. But you need to say briefly in the last video you touched upon it. Do you want to tell people again like your background and a bit about you?
Absolutely. So I've worked in charities since I left university, so about 10 years now. I've worked in a range of different charities, mainly different support services. Most recently I worked at Survivors UK, which is a charity supporting men and non-binary people who've experienced sexual violence. So it's responsible for a range of different things, including managing some of our support services. So I'm really excited to take that experience into Sarcoidosis UK.
And we're excited about that. And what particularly interests you about Sarcoidosis UK? Like, how did we manage to catch your attention?
So I think I'm really interested in small charities and how they can make a big difference. And I think you can see that Sarcoidosis UK has already made a huge difference, even as a small charity. And I think there's something really exciting about having the possibility of finding a cure on the table. I think that makes the work all the more interesting and inspiring.
We're definitely the small charity that can. I mean, that's the thing that excites us and gets out of bed. We spend the majority of our money putting it into research towards a cure. Right now we're funding as a small charity, we are funding a drug trial. It's almost unheard of. So azithromycin, which is an mTOR blocker, mTOR was discovered to be potentially have an impact in sarcoidosis. There are already mTOR blockers on the market, but they're not licensed for sarcoidosis. We don't know if they have an impact on, so we are trialing that right now. So that's a drug that's already out there that might help us. And we're also looking at other proposals right now that are similar, where drugs are working similar diseases, and we just need to find out, do they work for us? And we're going to keep doing that until we don't have to. That's the aim. And until we have a cure, we provide support, we provide quality information, and build awareness of the disease, so that we can help until we have that cure, make that difference. Actually, Jack's been doing a lot of work within the NHS to try and make sure that the NHS treat all of us properly, and that is an important part of the work that is being passed on. So we asked you about what interests you in SarcoidosisUK, but it'd be fun to ask Jack, you've now worked with Alan for since the start of the year, so it's not very long, but enough time to sort of get a handle. How are you finding it? How are you finding Alan? What's impressing you so far?
Yeah, it's going really well. I've been really enjoying working alongside Alan, and just to know his amazing experience working at SarcoidosisUK, which he's been part of for a similar amount of time as I've been at SarcoidosisUK, and really they were a small organisation when he started, and now they're a medium-sized charity who have achieved so much in that time. So for him to be bringing that amazing experience feels great. It feels like we're going to be in very safe hands. And just from working with him, today and yesterday and last week, he's been teaching me things already, and has got amazing experience, particularly in areas like support groups, which I think are going to, there's going to be a great new energy brought to our support groups network, and Alan's got some really amazing ideas there. And great fundraising experience as well. So I'm excited for the future with Alan.
No, great. So you were talking about that you've been teaching each other things, which is fantastic and a great transition. So it'd be nice to know. So what other parallels do you see between the work you were doing at SarcoidosisUK and the work you're looking to do here? Yeah.
So I think there are parallels around the kind of silence and lack of recognition of the cause. So around sexual violence, people don't want to talk about it. It's not something we hear about a lot necessarily.
Well, we do want to talk about it, but no one can ever pronounce it. They certainly can't spell it. And it's hard to understand. So we have this communication issue. We also have communication around doctors, particularly ones who are trained earlier, not realizing how serious it is. And so we see people who get very damaged, which you don't need to be.
So I think there's a parallel around raising awareness of something that's not spoken about enough. And I think there's also a parallel of my work was as what's called an independent sexual violence advisor, and managing that service, supporting people that were reporting to the police and going through that process. And in other roles, I've supported people going through different difficult processes. And I think there's a parallel in the way that people struggle sometimes to get a diagnosis and to get a care plan after a diagnosis. And I think it's really important that whatever that journey looks like, people have access to support if they need it. And that's why the helpline and the group work are so important for people.
Oh, great. And you've already, I know, I've been listening to you on the phone, and I know you've been great with a lot of people, and I know you've been scheduling in calls, and it's been wonderful seeing you do that. I have to say that. Well, if anyone gets the chance to want to call in, Alan has a wonderful phone manner, and actually is very nice and kind, and which is the most important thing. We wanted to talk about the future. So, what are you looking forward to in SarcoidosisUK? What's the Alan future?
Before you answer that, and this is just a good point to just say, anyone that's watching, if you have got questions and would like to write a comment, questions for Alan, or questions for myself and Henry, then do. And if we can, then we'd be happy to answer them.
We're all happy to answer questions. And a lot of people sent some stuff in before, and so we've been going through those, but we're nearly done. So if you have any burning questions, otherwise, just email in, contact us, and we'll answer those directly. Okay, the future.
Yeah, I think I mentioned earlier it's really exciting that there's a possibility of finding a cure, and I think finding out more about the research opportunities and the research that's happened is really exciting. And I'm really interested and excited to meet and hear from all of the wonderful supporters that Sarcoidosis UK has. I've already been impressed by the community that exists around the cause and the dedication of the people to support each other on Facebook, to raise funds, to raise awareness. And I'm really looking forward to hearing more from those people. And if anyone has any questions now or in the future, then please feel free to get in touch. Don't hesitate.
Yeah, and any ideas people have for us. So we're a small community, right, that are affected by this disease. As many people know, I was diagnosed in 2004, there's only us to help each other, right? So you getting involved in helping is incredibly important. Karen Bramwell has asked a question. How many types of sarcoidosis are there? The answer is both one and lots. In terms of sarcoidosis itself is a specific disease. It's granulomas within the lymph system. The lymph system, however, goes throughout the body into every organ. It's a complement to the blood system, and so it can affect absolutely any part of you. And so we have created specific web pages and leaflets, which we've done with the best consultants in the land on the main places that sarcoidosis impacts. So I highly recommend looking at those. And if you've got any specific questions, we'd obviously love to answer. But thank you for the question. Thank you, Shelley, for the welcome for Alan.
Thank you.
So we're talking about the future. What's exciting you about 2020?
So I think, as I said, the research is really exciting. I'm interested to hear more about it and to meet all the wonderful supporters.
And I think you're going to get involved with working on our support groups, expanding those out. I know we've got some sort of boring technological things, so in the back end. So there's been a lot of advanced work that the Survivors UK have done that we can learn from. So I think we're pretty good, but we're always looking to learn and try and be better at the back end operations, so that, frankly, they cost the least amount and as efficient as possible. So Jack, what about you? So Jack is going to be transitioning to becoming a trustee. So he's already been at our trustee meetings and having a huge impact there. But you're still involved now more on the strategic side than the doing side. But so what are you looking forward to in 2020 for Sarcoidosis UK?
I'm very honoured to be future trustee of Sarcoidosis UK. It's amazing to have had the opportunity to work for the charity for so long and now to be still involved with the charity ongoing, and we do have such an amazing group of trustees, so to be part of that is really exciting in itself. I think, as Alan said, I'm really excited about our research, and as the charity grows and we're able to look down different research avenues and talk to a wider variety of possible researchers in the UK and even in Europe, and it's really exciting, all the opportunities that are out there. And in addition, we've been funding research with the British Lung Foundation since 2015, and those are mostly 3-year projects. So over the next few years, we're going to be getting results back from research that we funded, and that's incredibly exciting as well, because those results could be really meaningful, and they certainly will give us next steps of things to investigate and look into when we're trying to search for a cure.
We are, and actually Claire Louise has asked, are we any further with the answer to why Do you want to answer that, or shall I?
You can.
So obviously it's a massive problem that we don't know why. We know that we've done studies of the genetic component. We don't think there's much there. We funded a project with Oxford University with Professor Ho, which looked at some particular genetic markers, and they weren't indicative. But we do want to get involved with one of the big genome studies, either the UK one or the American one, 23andMe, and we're starting to have those conversations. But when you look at family histories and stuff, it doesn't look like there's a large genetic component. A lot of thought is around, is there a trigger? And so we are currently funding a study. It's called a breath study. So this is one we're doing with the British Lung Foundation, which is looking at everything that's in someone's breath. So all the viruses, all the bacteria, a number of the different some different components, and those can include in you the sort of autoimmune responses, and to see if there's a commonality. So if we can see that everyone has been impacted by a virus or a fungus, or some kind of trigger, and we don't know the answer to that, but that's one of the things we're looking into. With mTOR, we discovered the University of Vienna did a study, and we discovered that mTOR was critical in the pathway of the creation of granulomas, and that was a mouse study. So we are not doing animal testing, but they did. And so we're looking at that, and we're sort of really cutting to the chase on that and just doing a test to see if we put in an mTOR blocker with some people in sarcoidosis. So we're doing that right now. That is being done with the University of Hull, who we've already done a study with. And so looking to see if that can provide us with a cure. So the answer is we don't know, but we are looking into it. It's very much something we're trying to find out.
Do you want me to answer?
Yes, because I was busy talking and not reading.
No, it's a good answer. So there's just a couple more questions. There's one from Claire again, which is where can I find out about all the research? So there is a lot of information on our website, Claire, about the research. There's actually a website page dedicated to each research project. So it should just be easy enough to find on the menus. If you look at under research on the menu, and then you'll see it all broken down there. Yeah, there's lots of information. But if you do want to find out more, then you can give us a call or give us an email, and we'll see if we can answer any further questions. And thanks for your great question, John or Granville. Really good question. I think it would be useful for you maybe to have a conversation with one of our nurses on the nurse helpline, because those, they're quite detailed questions, and quite important questions as well. So if you want to get in touch, and I can set you up, or Alan can set you up with a call with one of our amazing nurses, but just in very and
the nurses, to be clear, because they personally have people that either have or have someone they love has sarcoidosis, and they've answered how many calls now?
Thousands
of calls. And so actually, although they are at the nurse level, they are an incredibly deep amount about sarcoidosis and are very helpful. And the way we've set up the nurses helpline is with the support of the Saturday Fund, is that your call can last as long as you need. There's no schedule to it. On the flip side of that means we can't schedule you in, so we kind of tell you roughly when they're going to be able to call, but so that anyone can speak for as long as they like. So I really highly recommend a call. In terms of having fibrosis, there are things that can be given to help alleviate it. Obviously, the fibrosis is one of the major impacts of sarcoid. I have some that remains with me. And it's obviously very significant.
And just to add to that, our most recently funded research project, which only went live at the end of last year, is at the University of Southampton. So that's, Dr. Mark Jones is leading that project down there, and they're actually investigating that issue about treatments for lung scarring, fibrosis, and they're using cutting-edge technology down there in the lab to actually create 3D models of lung scarring in sarcoidosis. And they're investigating if existing antifibrotic treatments, so for instance, nintedanib, which is used with idiopathic pulmonary fibrosis, if that is effective on sarcoidosis patients with fibrosis. So that's something that we know is an incredibly important issue, and we've committed the research funding last year into that. And in terms of your question about neurosarcoidosis, the short answer is yes, it does have an effect. It's treated in quite a different way to pulmonary sarcoidosis, but I think talking more with our nurses is the best option for you there, so do get in touch.
Yeah, and Linda, talking about the specific of hotspots on the skin, obviously skin sarcoidosis is something that happens to a lot of people, and actually the Dame Helena Shovelton, who used to be head of the British Lung Foundation, she actually had skin sarcoidosis as well. One of our trustees has skin sarcoidosis. I'd recommend talking to our nurses and obviously talking to your own doctor. But there is a full set of webpage on skin sarcoidosis, and I would highly recommend looking at that. And Claire Sean, interviews with Sarc specialists. That is definitely on the plan. So our 2020 resolution is that we want to have doing more video. I think certainly I'm enjoying this. I think it's been really effective, and seeing people's questions come in and has been great. And obviously these videos, stay on the website. So we're going to, after this, we will leave it on Facebook. We'll subtitle it up. I think that's Alan's job. But actually then we'll put it on Twitter and Instagram as well, to sort of get it out as widely as we can. And we are obviously going to answer any more questions. But the idea of having specialists do this as well, I think is a fantastic idea. And we'll do the same thing where we'll ask for some questions, answer those first, and as people get in, then they can answer their own questions. Although probably won't be able to be specifically about individuals, so you'll be able to put in your, because they can't see you, so they can't diagnose you immediately, but they will do that. So we will set that up. I think it's a great idea. It's certainly part of our 2020 plan. And there are more questions.
Okay, great. Thanks, John, for your reply, and it's great to hear that you'll get in touch and set up a call with the nurses.
And Libby, I think biopsy is very important. I had a biopsy in my lungs on the definitely Sarc. Our problem with our disease is that definitely is hard to have. It's mostly, in many cases, a disease diagnosed by exclusion, by making, not acknowledging it's not other things. So therefore, the fact it's presented like this means it's sarcoidosis. And actually, generally in medicine, definitely is a hard thing to get. But I think they will be very, very confident in them, and they, yeah. And it does slightly depend on how you present to and how clear it is. I wish I could just say yes, but that's not it. Professor Wells, Dr. Kidd, definitely they're on the list. Although we do already have a Professor Wells video up, and Dr. Kidd, do we have?
That's what Joe was saying. So there are.
Oh, sorry, Joe. Sorry, yeah, they're up already. But those are interview ones, not live ones. We will talk about them if they feel if we're going to try and persuade them to do live as well.
Yeah, sounds good.
Okay. Well, look, thanks, Yvonne, for your message. And I think Jack is reading one from Andy. Oh, that looks very complicated. I think Andy, we will come back to you privately on that, because I think I don't know the answer immediately, so I'd rather wait.
It's a good question, Andy.
It is a very good question.
And it's a very topical question, so you're definitely kind of up to date with everything that's going on. But I think, yeah, I'll message you privately and we can talk about that. But there hopefully will be an update about biological treatments quite soon.
And Granville, sorry, I wanted to come back on the fibrosis question. So one of the big elements that we're looking at for the research is one of the areas of target is, why do some people get sarcoidosis chronically? Why do they get fibrosis much more than other people? And if we can see the difference, then we can think about treatment plans and how they need to be different for those people. Think about the interventions that are needed. And actually, so we are. Look, everything's about fundraising. This is not about fundraising, but the money that is, people are very kind enough to donate and to raise for us, are primary places put into research. We were looking at a research project just this morning, which is a smaller research project that's specifically looking into an element of that question. So obviously it's very complicated, but there's someone has a target where they think they might be able to see the difference, and we're definitely looking to see if we can fund that. But certainly one of the major questions we're looking at is what is that difference, and how can that help us with our treatment plans? Claire has asked what are biological treatments. Plinirizurone is a hormone. So I think it is considered a biological treatment. I think that's what he's saying, and that's actually why plinirizurone is both so good but it also has so many challenges around it, because it's such an instrumental part of your body, and why actually it's very important to taper off, because your body, if you're taking it as an extra, your body stops producing it internally. And so if you don't taper off, your body doesn't build up its own production of it. And so certainly when I was reducing my dose, it was very difficult to do. I had to do it very, very slowly. And I think that a lot of us have been on it or are on it, and that's an incredibly important part of it. Okay, I think we're out. That's the out of questions. Thank you so much for everyone who's joined us. That's been it's been wonderful. We're definitely going to do more of these. The suggestion to get specialists involved, we will definitely also do that. We'll also try and, I think, bring in other charities who are in similar positions and have similar disease, so you can look and you can see us learning together. But obviously, primarily, we're fundraising, putting money into that research. We have the partnership with the British Lung Foundation, where we work with them, and they double our money. We work with their research platforms, so we know it's quality research. We know that our money gets doubled, which is clearly very important. Allows us to increase our impact hugely beyond just us. So great. So thank you very much indeed. Welcome, and welcome Andy, and I'm calling Andy, and because there's an Andy here, and obviously it's not goodbye, Jack. It's Jack moving to being trustee, being but moving from the doing to helping us. But when he first talked about it, he said, I really want to stay involved. Right? So we are the little charity that can, and the little charity that loves. Right? We have well, hopefully you see we have our big aims, we have a big heart. So and we're trying to do good with the little we have. So and we can't do it without you, and we do it for you. So we are a small community of people who care, and together we can do it, and we can find that we can fund the research to find the cure, and then we all go home. And that's it. But that's the plan. Thank you very much indeed.
Great to talk to you all.
And really wonderful to speak to you, and thank you for watching.
Thanks.
See you.
Bye bye. Thank you. Bye.
Whoops.
Bye bye. Thank you.